So we've been dispatched to Nikki, a 31-year-old female with a chief complaint of a severe headache. She explained she began feeling this pain at work and then came home early. She has a history of migraines, gets them quite regularly, explains that her symptoms today feel the same as usual. She's got a throbbing pain at the front of her head along with nausea and vomiting, nausea and photophobia. So on evaluation, we gathered the following vitals. So she's got a GCS of 15. It's important to gain an accurate GCS as an altered level of consciousness can indicate an intracerebral hemorrhage. Heart rate is 65, BP of 120 on 75. So if she'd been hypertensive and pregnant, could be indicative of preeclampsia, but we've ruled out both of those. So rest rate 16, SpO2 99%. We've got a temperature of 36.8. Temperature must be taken because a temperature greater than 37.5 can indicate meningitis. Good capillary refill time at 2 seconds, peripherally and centrally. Pain 7 out of 10, and she is fast test negative. So Nikki, I just have a few more questions about your headache, if that's okay. Can you tell me whether it came on suddenly or quite gradually?
Slowly, like my normal migraine.
Okay, perfect. So a sudden onset of a severe headache can be indicative of a subarachnoid hemorrhaage or vertebral artery dissection, and it's a red flag. So you mentioned that you feel quite nauseous. Have you been vomiting at all?
No, I haven't vomited.
Okay. And you haven't hit your head recently? No trauma to the lungs? No. Okay. And do you have any, like a altered sensation in your eyes, or you've got scalp sensitivity, or no achy bones or joints?
No, I just feel like my normal migraine.
So those, along with sort of jaw symptoms, headache, jaw pain, headache, are all signs of temporal arteritis. So assessing for those needs to be undertaken as it's a red flag. Do you have any previous history of intracranial bleeding, so bleeding from your brain?
No.
No, you don't have any family history of cerebral vascular abnormalities, so difference in veins in the brain?
No, everyone's pretty healthy.
Okay, perfect. So do you have any medical conditions that I should know about, or do you take any regular medications?
I don't take any meds, just my migraines I normally get.
Okay. So you need to ask whether they have any medical conditions, or that they take any regular medication, to make sure that the patient isn't on any anticoagulants and doesn't have a known bleeding disorder, as that's also a red flag. Nikki, I know you said that you had the onset of the headache at work, but I do have to ask whether your onset of headache started with any sexual activity.
No.
Okay, perfect. So sudden onset of headache during sexual activity can be associated with a subarachnoid hemorrhage, and again is a red flag. So Nikki, we just need to perform a few little physical tests, if that's okay. So would you just be able to kind of do the same movements as me? So move your head towards each shoulder for me, and down to your chest. Okay, did you have any pain or neck stiffness then?
No.
Okay, and I'm just gonna move my fingers on the back of your neck. Is that okay? Okay, so you don't have any pain here?
No.
And none down there?
No.
Okay, so neck pain following neck manipulation can be indicative of, again, vertebral artery dissection. Neck pain or stiffness can also be associated with subarachnoid hemorrhage or meningitis. So again, all of those are red flags. So we're now going to assess for focal neurological signs, as this can be indicative of an intracerebral hemorrhage. So Nikki, can you tell me what day it is and where we are?
It's Monday, we're at home.
Okay, can you tell me who I am and where I'm from?
You're Adelaide from AUT Uni, you're Paramedic.
Perfect. Would you be able to put your finger on your nose for me? And then out to my finger, back to your nose, out to my finger, back to your nose. Awesome. And then I'm just going to move my finger over here. Can you keep your head nice and still and just follow it with your eyes? Mm-hmm. Awesome. Perfect. Okay. Awesome. So in order to leave a patient at home, the non-transplant checklist needs to be completed. So we've fully assessed our patient, no abnormal vital signs, we've ruled out any serious injury or illness, as we've indicated that no red flags are present. We also saw Nikki mobilised earlier, both her and we all thought it was normal for her. So Nikki, my crew partner and I have both decided that we think it's suitable to leave you at home, it's safe, but we do want to offer you some pain relief, if that's okay.
Yeah, that'd be good, thank you.
Yeah, okay. So as per the St John Clinical Practice Guidelines, a patient with green flags, which includes a known migraine with usual symptoms, may be left at home and administered a single dose of a combination of oral medications. So for Nikki, the best option for us, we think, is ibuprofen, paracetamol, and Ondans. CBGs outline how opiates are strongly discouraged in the setting of a migraine, which is our rationale for not giving tramadol. So Nikki, I'd like to give you some ibuprofen, some paracetamol and some ondansetron. Have you had any of these?
I've had all of them.
All of them? Also, you've never had an adverse reaction? You've never had any today?
No.
Okay, and you don't have any allergies?
None.
Okay, perfect. So as we can tell, Nikki is less than 80 kgs, so we're going to administer 400 milligrams of ibuprofen, 1 gram of paracetamol, and 8 milligrams of ondansetron, all orally. And I'm just going to drug check that with my partner up here. So I've got paracetamol 500 milligram tablets in date.
Paracetamol 500 milligram tablets in date.
Perfect. I've got ibuprofen 200 milligram tablets in date.
Ibuprofen 200 milligram tablets in date.
Cool. And I've got Ondans 4 milligram tablets, both in date as well.
Ondans 4 milligram tablets in date.
Okay, perfect. So Nikki, here are your medications. What I'd like to do is I'll give you your ibuprofen and your paracetamol first. You take that with some water. Are you ready? Cool. Okay. And then I'm going to give you our Ondans once you swallow those. And what I want you to do is, without water, just place it on top of your tongue and you just let them dissolve. Okay? Nikki, do you have any paracetamol ibuprofen at home?
Mm-hmm.
Okay, so what I'm going to advise you do is take them every 4 hours. So if you take them every 4 hours rather than waiting for the pain to start up again, it just keeps you above that pain threshold, and it just minimises how you feel. Okay?
Yeah.
So we're going to leave Nikki at home. Well, that's what we've assessed so far. We're also going to give her an information sheet about migraine. So it contains an explanation of what a migraine is, some general advice around migraines, and when to seek further help and from who. So Nikki, this is our migraine information sheet. So what I'd like to do is just point out here some general advice. So it does explain that some preventative measures could be seeing your GP and asking for some medications that may prevent the migraines, or that sort of stuff, like whether there might be a referral that's indicated for you. Also over here is where you need to call us back in case anything gets worse. Okay, awesome. So now that we've given our patient our migraine information sheet, we can safely leave her at home.
So today we have been called to Adelaide. She's a 45-year-old female who has a chief complaint of lower back pain. On examination today we found the following vital signs, which are on the screen now. All vital signs appear to be within normal range. Talking to the patient about her history, she has a history of chronic lower back pain as well as high cholesterol, and for these she regularly takes simvastatin as well as paracetamol and ibuprofen. The patient had an initial injury to her back 1 year ago, which was diagnosed as a musculoskeletal injury. Since this, she has had multiple exacerbations, and today she's had the onset of pain on waking up this morning. The patient said she went to lift herself out of bed and is describing the pain as sort of a seized and stiff back. She says that this often occurs when she sleeps flat on her back, which she thinks that she did do last night, and she can't recall any other mechanism of injury which would have caused the exacerbation. So the patient said she has otherwise been well recently. So what I would like to do now is perform a focused back assessment as well as a neurological assessment, and we'll go through our red flags for the condition. So Adelaide, what I'd like to do is first just have a little look at your back just to see if there's any obvious sort of things going on back there. So in exposing the back, there's no obvious bruising, discoloration, swelling. I'm just going to touch your back, so just tell me if it's too sore or anything. Alright Adelaide? So having a feel of the back, there's no obvious deformities. However, the muscles on both sides of her spine do feel quite tight. That's fine, Adelaide. So what I'd like to do now is just sort of test the range of motion and power in your legs. It's just sometimes back injuries can cause sort of deficits to these areas. So I'll get you to put your feet up on this chair for me. If anything is too painful, just let me know and we'll stop, okay? So to start, can you wiggle your toes, please? Can you pull your feet towards you, push them away from you, and back up, and push me away as hard as you can. Perfect, that's nice and strong. Can you bend your knees up for me, please? Perfect, and back down. Can you lift your feet up from your hips, so lift your whole leg up, perfect. And the other side, does that feel normal for you? Yep, all good. So the patient has nice strong power in both legs. Can you lean forward and try and touch your toes for me? Perfect. Is that about a normal sort of stretch for you? And does it feel all right down your back?
Sore, but like normal sore.
All right, perfect. I'm just going to have a feel of your pedal pulses here, just to check for any limb compromise. And we've got nice strong equal pedal pulses in both legs, which is fine. I have observed the patient walking. She came and opened the door for us. The patient said that it all felt normal and it looked fine. I'm just going to feel down your neck as well. Tell me if there's any pain anywhere that I feel down here. All fine? Can you twist your head to either side and chin to chest? Does that feel alright? Perfect. Okay. The other thing I need to do is an abdomen assessment. So again, I just need to expose your tummy and just have a feel of that as well. I'm just going to lift your shirt up a little bit here. Beautiful. So again, there's no obvious discoloration, bruising, swelling. I'm just going to have a feel. Adelaide, does that all feel fine there? And down lower down here? Yep. Alright. And if I feel into your back on your flanks, how does that feel? It's fine as well? Yep. Okay, you haven't had any burning or stinging when you pass urine?
No.
Okay, and passing bowels, when did you last pass a bowel?
Last night.
Last night. And did it all feel sort of normal to you? You have normal sensation? Yep. And in your saddle area around here, do you have normal sensation?
Yeah.
Yep.
Yeah.
Alright, perfect. So the focus back assessment looks to all be intact, everything looks fine there. Just to finish off the neurological exam, I'd just like to test your dermatomes. So to test L4, I'm just going to touch the top of your shins here and on this leg. Do they feel the same, equal? Okay, to test L5, I'm just going to touch the top of your ankle. Does that feel alright?
Yep.
And on this side?
Yep.
They feel equal to each other?
Yep.
Okay, and on the underneath of your feet, I'm just going to give you a little tickle for S1. Normal and equal? Perfect. So the neurological exam also looks to be intact. So I'm now just going to go through my red flags for this condition. You haven't been incontinent at all, have you? So we've got no loss of bladder control. We have a temperature of 36.8 degrees, which is fine. Have you had any cold shakes or anything like that? No. So I've got no rigors. Vital signs are all normal. Pain is isolated to your lower back. You don't have any chest pain or upper back pain. Perfect. So that abdo assessment was fine. We've talked about the saddle area, which was also fine. The patient has equal power in both legs. We've seen the patient mobilise and that was all fine. We don't have any other signs or symptoms of generalised illness, and the patient said she has otherwise been well. And we don't have pain radiating both legs. It's all isolated to the lower back. The patient also doesn't meet the orange flags. However, she does meet both the points for the green flags. So because she meets the points for the green flags, the patient is able to be left at home, and we just recommend that she see her GP if the symptoms or pain do not resolve. Okay. So have you taken any pain relief today?
Not yet.
Alright, so we can give you some paracetamol and ibuprofen for the mild to moderate pain because you're sitting at a 4 out of 10 for pain, if that's right. Okay. Alright, so I've got some paracetamol and ibuprofen, which I have drug checked with my OSCE already. So I will give you 1 gram of paracetamol. I'll just check my... Do you have any allergies?
No.
Do you currently have paracetamol poisoning?
No.
No. And you're not in your 3rd trimester of pregnancy? No. Alright, perfect. So what I'll do is I'll give you 1 gram of paracetamol, and I'll give you 400 milligrams of ibuprofen. So you just take those. And I just recommend that you take these every 4 hours just to keep on top of that pain. Do you have a nice stock of it at home here?
Yeah.
Alright, perfect. So that is all fine. We also recommend that you sort of get up and stay a bit more active, just because if you sit down too much, those muscles are going to seize up. So getting out, walking around, just doing normal things will help the muscles sort of relax a bit and get them moving again. So what I will do is I will give you, I will just go through my non-transport checklist just to make sure that we can leave you at home. So we've fully assessed the patient's vital signs are all fine. We've excluded any serious illness. We have no red flags. We've seen the patient mobilise, and we will leave information with the patient, and we'll also complete our paperwork, and the patient will have access to this. So Adelaide, this is an information sheet on chronic lower back pain. So it just has a description of what it is. It has some points on when you need to call the ambulance back or go to your GP. And it also has some advice here on things you might want to talk to your GP about, like going to a physio or a chiropractor or that sort of thing. All right?
Yeah.
Are you happy to stay at home today?
Yeah.
Okay. So everything looks fine to me. I think it's safe to leave you here. All right? Okay. I'll leave that one with you.
Thank you.